Hi guys, you're welcome again to the Hydra Healthcare Talk series. It's been a while, I know. I promise I will try to be consistent. Just I have a lot going on. But today I can't, but share this. It's about sleeping problems in the older person. So I'm going to be sharing 5 top causes of sleep problems in aging. A lot of us, we have older people that we are concerned, that we care about and we love. So once they come down with sleeping problems, it's always very disturbing. So what are the 5 common causes of sleep problem in aging? So stay tuned and I'm going to share that with you. So generally, older people tend to sleep, earlier in the evening and less deeply than when they were younger. But when does it become a problem? When an older person is saying, I find it difficult to sleep, or when should you contact your doctor, or seek help? First of all, you need to know that aging generally affects every part of the body, every part of the system of the body. So sleep is also one of it. You need to be able to monitor the pattern of sleep to be able to see if there's something different or something that is really concerning. Then you can seek for help. So number 1, the first sleeping problem can be due to some underlying medical condition. So if another person has an underlying medical condition, it can lead to a sleeping disorder. For instance, conditions that affect the heart and the lungs that make breathing very difficult can affect the sleeping pattern of the older person, like heart failure or COPD. Gastroesophageal reflux disease, that causes heartburn as well, can affect the sleeping pattern of the older person. This can lead to heartburn and some other symptoms as well that can upset the older person at night. When an older person has osteoarthritis, pain in the night can also affect the sleep pattern. Urinary problems like going to toilet or urinating more in the night, even if sometimes the older person can be on a certain medication that makes them pee more often at night, it can affect their sleep pattern. And some other neurodegenerative disease like Alzheimer's and Parkinson's can definitely affect the sleeping pattern. So that's the first one. Second cause of sleeping problem in older person is what we call sleep related disorders. So it's an umbrella term, like when it comes to snoring, sleep apnea. So when another person is sleeping and cannot breathe well while sleeping, and then it can affect the sleeping pattern. The third common reason why an older person will have sleeping problem is restless leg syndrome. So the restless leg syndrome, it's a condition that causes sensations of itching, crawling, or restlessness as a person is trying to fall asleep. So for this kind of older person, we'll find it very uncomfortable while sleeping and tend to be awake more. Most cases are not thought to be related to neurodegeneration. The fourth one, which is kind of rare and sometimes might not be treatable, is what we call the periodic limb movements of sleep. Periodic limb movement of sleep. That means when an older person is asleep, there is this intermittent movement while the person is asleep of the limbs. So usually the toes, the ankles, the knees, or the hips. Why it might not be too disturbing to some, generally like 45% of older persons will experience this, but to some other it could cause sleeplessness. And the fifth one, it's what we know as insomnia. I think that's the most common, cause of sleeplessness in older person and generally in older people. So insomnia means having difficulty falling asleep or staying asleep despite the opportunity to do so. So even if the patient is in bed, is still having difficulty to sleep. So and this is very common in older person. So I've talked about 5 common causes of sleep disorders in older persons. In the next video, I'm going to be talking about how we can treat the sleep disorders in older adults. Don't forget, if you are concerned with the sleeping pattern of your older one or even yourself, please speak to your doctor or talk to a healthcare professional or visit the next hospital or healthcare facility near you to raise your concern. Till we meet again, continue to age well.